Do you have diabetes and want to come off diabetes medications? Stick around because in this video, I'm going to expose what Big Pharma doesn't want you to know about diabetes. But first, hello everyone, my name is Ray. I'm a nurse practitioner who specializes in cardiology, hospital-based medicine. If you're new to the channel, welcome. If you're not new, welcome back. In this channel, we like to talk about heart disease, both prevention and treatment, other topics related to the heart and overall health and well-being. So if that sounds good to you, please consider subscribing so you can become a part of this growing community interested in improving our health and lifespan. In today's video, I want to talk a little bit about diabetes, specifically type 2 diabetes or adult onset diabetes. When I worked in the ICU, I was a diabetic resource nurse, which means I would help provide education to both new nurses as well as patients about their disease process and how to mitigate it. When someone first gets diagnosed with diabetes, there's a lot to navigate, such as making sure that they see a podiatrist to assess their feet, ophthalmologist to assess their eyes for something called diabetic retinopathy, and dietitians to make sure that they get an appropriate diet plan. So it's very important that newly diagnosed diabetics are referred appropriately. Diabetes is a major contributor not only to heart disease and strokes. In case you don't know, by the way, a stroke is a heart attack, but in the brain. So, and also many other diseases and disorders like kidney disease, circulatory problems, and blindness. Diabetes, in a nutshell, is a progressive loss of insulin secretion from your pancreas in a setting of insulin resistance. It's a very complex and difficult to manage disorder because by the time people are diagnosed, their diabetes is typically incredibly advanced. Diabetes is typically diagnosed when someone has a hemoglobin A1C of 6.5 or above. And for those that don't know, the hemoglobin A1C is basically like your 3-month report card of what your blood sugars have been running. So for the purpose of this video, I want to try to be as succinct as possible. I won't go into too much detail unless you all want me to. If you feel free to leave a comment down below if anybody wants more details about the patho and physiology about diabetes. My wife is someone who loves to know the why, so I know there are some people out there that like to geek out on the details, but I digress. In this video, I want to just give a quick guide on how to manage diabetes, especially in regards to diet. One of my subscribers, Chantelli, shout out to Chantelli, gave me some feedback asking about what type of diet she should be eating. So it gave me the inspiration for this video. First and foremost, if you've been recently diagnosed with diabetes, please make sure that you have a trained medical professional helping you navigate your condition. Oftentimes, people that first get diagnosed with diabetes have other coexisting conditions that also need expert management, for example, a kidney specialist or a nephrologist. The number one cause of kidney failure is actually diabetes, followed by hypertension. So again, a lot of times people have all of the above. So let's say you've been diagnosed with diabetes and you were given a medication such as metformin. Metformin remains the first line of therapy to help reduce your hemoglobin A1C. Thankfully, newer guidelines also recommend adding medications such as GLP-1s. Make sure you go check out my video about GLP-1s that I'll link at the end of this video to learn more about these powerful drugs, as well as medications that are in a class of medications called SGLT2 inhibitors, which are medications that are used for both diabetes as well as kidney, and they also have kidney and cardioprotection, specifically those with heart failure. In my line of work, I use SGLT2 inhibitors a lot for patients with heart failure, and I'll do another video regarding heart failure another time. So these medications have been proven to help people improve their diabetes, slow the progression of heart disease, improve heart failure outcomes like reduce hospitalizations, and basically live longer. But here's the thing, there's only so much that medications can do. Obviously, I believe in the power of medications, and to be clear, I'm not sponsored by any drug companies. I always think it's funny when people think that healthcare providers are being funneled money to promote their drugs. I'm like, where are all these drug companies? Why aren't they knocking on my doors? But in all seriousness, my opinions are my own, and the stuff that I talk about is all evidence-based practice. So anyway, back to my point. Meds can only do so much. Lifestyle modifications must happen simultaneously while on these drugs. I like to tell people use the medications as a bridge to get to the other side of the health continuum. They should not be designed to be used indefinitely. Sure, the drug companies would love nothing more than to keep having your provider refill the medication every 90 days, but why would you want to keep lining those drug companies' pockets? Did you know that the American Heart Association and the American College of Cardiology actually recommend exercise as a first-line therapy for people with high blood pressure and high cholesterol? The American Heart Association and the American College of Cardiology endorse the recommended 150 to 300 minutes per week of moderate intensity aerobic activity, or 75 to 150 minutes per week of vigorous intensity aerobic activity, or an equivalent of both. in addition to aerobic exercise, muscle strengthening activities involve all major muscle groups and should be performed at least 2 or more days per week. Both of these also help with diabetes management. In fact, the American Diabetes Association recommends similar amounts of exercise as the ACC and AHA, but the American Diabetes Association also recommends things like walking, yoga, housework, gardening, swimming, dancing, jogging, and Tai Chi. The ADA, or American Diabetes Association, also recommends interrupting prolonged sitting for more than 30 minutes. I actually have a little productivity hack that I can share with you. I use to help stay focused on my work as well as staying active throughout the day. It's something called the Pareto method. You may have heard of it, but basically you set a timer for 25 minutes, and when the timer goes off, you stop what you're doing and set a 5-minute timer. And if I'm working from home, I'll try to get on my treadmill for a few minutes, bring my water bottle, hydrate while I'm getting some steps in. This helped me so much when I was studying for my boards. On a side note, if you don't have a home treadmill, you're missing out. You can get a walking pad on Amazon for like 150, 200 bucks. It's a pretty small investment to make on your health that will pay dividends. But yeah, aerobic exercise and strength training has been shown in meta-analyses of randomized controlled trials to lower your hemoglobin A1C levels significantly, as well as having cardiovascular benefits, improving insulin sensitivity, lipid profiles, blood pressure, inflammatory biomarkers, and it's associated with lower cardiovascular and overall mortality in both type 1 and type 2 diabetes. So now that you know that exercise is incredibly important for and essential for managing diabetes, what about the diet? What should you eat? All right, before I tell you what to eat, I have to tell you how you should eat, or more specifically, how you should not eat. People that have diabetes, remember we're talking about type 2 diabetes here, shouldn't be eating often throughout the day. Every time you eat, especially if you're having anything with carbohydrates, you're going to signal your pancreas to secrete insulin. Remember, like we talked about earlier in this video, diabetes is a dysfunctional insulin secretion system due to insulin resistance. So hopefully the wheels are turning here, but if not, let me catch you up. The less frequent we need to secrete that insulin, the better. Well, what's a powerful way to achieve this? You probably guessed it. Time-restricted eating, or intermittent fasting as it's now called nowadays. Fasting may be the hype, but it's been around since biblical times. We all fast every day when we go to sleep. That's why it's called break fast, right? Or breakfast, because we are breaking the fast. But intermittent fasting essentially takes our daily normal fast up a notch, and it's the intentional shortening of our eating window. According to the Endocrine Society, those are diabetes experts, in a Chinese study that conducted a 3-month study using intermittent fasting, 90% of participants were able to reduce their blood glucose, lowering medications, and 55% had diabetes remission. I'm going to say that again. 90% of the people in this study were able to reduce their blood glucose lowering medications, things like insulin or glimepiride. They were able to lower their medications, and 55% had diabetes remission. That's incredible, just by fasting. So here's a little bit of a better illustration of how intermittent fasting works. We all have 24 hours in a day, right? Well, we're supposed to be sleeping for 8 of those hours, and then we're awake for 16 hours, give or take. Well, a lot of people eat almost from the moment they wake up until close to when they're going to sleep. But let's say you're the type of person who says, I'm not hungry when I first wake up, so I don't usually eat until I get to work 2 hours later. Okay, cool. So instead of eating for 16 hours a day, you're probably eating for about 14 hours of the day. Well, you might say, well, I don't eat so close to bed, so I stop eating about an hour before bed. Okay, cool. So now you're eating for 13 hours of the day. Well, with the typical fasting regimen, or 16-8 fasting, you're flipping that completely around and only eating in an 8-hour window and not eating for 16 hours. This might sound impossible, but trust me, as someone who's been fasting for almost 9 years now, it's completely doable. And I came from previously being the type of person who would set an alarm on my phone to eat every 2.5 to 3 hours, because I thought that was the healthiest way to eat, to lose weight and preserve muscle. I mean, that's what bodybuilders do, right? Well, thankfully, we've come a long way in realizing that those old diet myths are just that. They're just myths. One of the greatest things about fasting is that it helps you get and stay in a calorie deficit. Ultimately, you need to be in a calorie deficit to lose weight. So what's one of the easiest ways to do this is to eat in a shorter window. I know for me personally, I like to eat pretty big meals. So I'd rather eat 2 big meals rather than 3 or 4 meals. Not only will this help you eat less total calories, but it'll also help regulate your blood sugars, which is what we want. Intermittent fasting is supported by the American Diabetes Association, but it does warn people to be mindful of hypoglycemia because hypoglycemia can be life threatening. So please be sure that you're under the supervision of a trained provider, whether that's a physician, nurse practitioner, etc. Especially if you're on medications to lower your blood sugar, such as insulin or sulfonylureas, such as glimepiride, glipizide, glyburide. If you have any of those medications in your cupboard, you might have a hard time with fasting because it can lower your blood sugar significantly. Remember, this fasting is a very powerful tool to improve your diabetes. So you may need to actually decrease your doses of these medications to avoid hypoglycemia. But again, this is a good thing, right? That means that you're less dependent on these medications. So how do you get started with fasting? Well, the easiest way to start off is low and work your way up. I trained in adult geriatrics, and we have a saying in gerontology is to start low and slow. Why? Because we understand the principle that the inventor and philosopher of toxicology, Paracelsus, coined back in the 1500s, which says, sola dosis facit venenum, which is the dose makes the poison. I think this is true with a lot of things in life, but especially with medications. If you give too much, you kill someone. You give too little, and it does nothing. So when it comes to fasting, going too much too soon will likely get you discouraged and lead you to quit prematurely. So I like to tell people to start like this. Your last meal tonight will be at 7 p.m. Don't eat or drink anything with calories until 8 a.m. tomorrow. That's a 13-hour fast. And it's actually said to be right when the benefits of fasting kick in. Start with 13 hours daily for about a week or two and see how you feel. After 2 weeks, if you're nailing it with no issues, change your breakfast time to 9 a.m. and then 10, then 11. Before you know it, you'll be eating in an 8-hour window like a pro. So now, just because you've mastered intermittent fasting doesn't mean you eat like a ding-dong in your eating window. So while there is some magic that happens, like things like autophagy, improved immune system, less food noise, smaller appetite, things like that, the reality is that the reason why people are able to lose weight is because of the overall calorie deficit they're in by the end of the day. So intermittent fasting is essentially a race against time. The longer you go without eating, the easier it will be to stay within a calorie deficit because you're not eating constantly throughout the day. All right, finally, we get to the part you've probably all been waiting for. What is the ideal diet for diabetes? Well, most people probably know that diabetics shouldn't eat sweets, right? Things like candies, cookies, cakes, traditional soft drinks. Those things will spike your glucose to smithereens. And then guess what? If you're on insulin, you're likely going to need to give yourself a hefty dose of insulin to get you back down to earth. So I think we should start there. Those are the things you should definitely try to avoid at all costs. A diet such as the Mediterranean diet has shown particularly strong efficacy when compared to the standard American diet. The Mediterranean diet also has weight loss and cardiovascular benefits, but here's the thing. Some foods on the Mediterranean diet, such as some fruits, whole grains, beans, nuts, and seeds, may still have a huge impact on your blood glucose. Everyone responds to carbohydrates differently depending on how high your hemoglobin A1C is or how bad your insulin resistance is. One very powerful tool nowadays is a continuous glucose monitor, or CGM. Do me a favor, if you're watching this and you're a diabetic, I want to hear from you. If you have a CGM, how has the CGM helped with your diabetes management? How has it changed since starting to use your CGM? Comment down below. I want to hear your stories and testimonials. I think having community engagement not only helps this channel grow, but also helps us realize that we all have something to share and contribute. So I'd appreciate it if you comment down below your experience. So back to the foods you should avoid. Even, quote, healthy foods such as rice and bread can spike your sugar way high. Don't even get me started on breakfast cereals. In a nutshell, if you're a diabetic, you probably should skip all breakfast cereals, period. Remember how they say breakfast is the most important meal of the day? I agree. I don't necessarily think you need to have it crazy early in the morning, though. So hopefully you're fasting. So let's say you're doing the fasting, like we talked about earlier in this video, and now you're going to try to incorporate a good diabetes-friendly breakfast along with fasting. I can tell you what you're not going to eat. You're not going to have a donut. You're not going to have a Pop-Tart. You're not going to have a Starbucks Frappa Ding Dong. No. A good breakfast for a diabetic would be something like 2 whole eggs scrambled with 2 egg whites and a serving of cottage cheese. This will provide you with about 290, 300 calories and about 36 grams of protein, only 3 grams of carbs. If you break your fast with something low carb like this, you won't get that crazy glucose spike. If you absolutely have to have a carbohydrate, I have a couple good options for you. If you're someone who has to have something sweet with every meal, which I recommend that you try not to do this. I used to do that, try to eat something sweet or dessert after every meal, and that's not a good idea. But if you do, for dessert, I would recommend having something like a half a cup of blueberries with some Greek yogurt. Now, this meal would be about 420 calories or so, and a whopping 52 grams of protein and only 18 grams of carbohydrates. So, I'm actually working on an ebook that will hopefully be a one stop shop comprehensive guide to heart disease prevention. And the first chapter that I'm working on is all about different diets and their pros and cons. By the way, I'm offering this chapter for free to all of my first 1,000 subscribers as a way of saying thanks for believing in me and subscribing to the channel. So if you're subbed, make sure you email me and I'll email you back that chapter once it's done. But in this chapter, I talk about how some doctors believe we should be getting 30 to 50 grams of protein per meal, and especially in that first meal because we want to stimulate muscle protein synthesis. Another good option to add with your breakfast is to try something like a good sourdough bread. This is low glycemic index and has fermentation, helps break down the sugars and slow down the glucose absorption. I personally like sourdough bread from Sprouts that have very limited ingredients, organic wheat flour, culture, water, sea salt, and enzymes. That's it. By the way, no, I'm not sponsored by Sprouts either. So remember, the goal is, especially if you're on insulin, type 2 diabetics, is to decrease your need for using so much insulin or so much medicines to lower your blood glucose. And the way you do that is to eat less foods that are high in carbohydrates. A good lunch option would be something like 4 ounces of grilled chicken, if you like, and can tolerate plant foods, maybe a cup of broccoli, and for dessert, you can have that cup of yogurt and blueberries that you decided to put off from breakfast, like I talked to you earlier about. So far, these meals will have you at about 750, 800 calories and 81 grams of protein, 45 grams of carbs, and 26 grams of fat. Percentage-wise, that's about 42% protein, 32% fat, and 24% carbs. Remember, for diabetics, ultimately, this is a blood glucose, sugar dysregulation, insulin resistance problem. So our goal is to not constantly keep our sugar levels high and give your body the best chance to heal itself. If you're only having 2 meals a day, depending on your total daily calories, you might want to double those serving sizes because you certainly don't want to be only eating 800 calories per day. But if you're having a third meal for the day, you can consider something like white fish that's low in fat but high in protein, or one of the fatty fish. I remember the acronym to help me remember the fatty fish is an acronym that's SMASH, SMASH, and that stands for sardines, mackerel, anchovies, salmon, and herring. Those are all good fatty fish. The good news is that all of these can be pretty much found in a can, so if you're out and about, that's the best fast food you can get. Bring a can of, salmon with you, or bring a can of sardines. If you're worried about the mercury, the brand Safe Catch has their mercury content listed right on their package. So generally speaking, you should probably limit mercury-containing fish to only about 2 times per week. However, smaller fish like sardines, they've actually been shown to be safe. You can eat them every day. There's actually a YouTube doctor, Dr. Boz. She's done videos about a sardine challenge where you essentially eat nothing but sardines for 3 days. I've seen tons of testimonials of people doing this successfully and resetting their diet and hunger signaling in their bodies. So I personally have not tried the sardine challenge, but I have considered it. If anyone watching this wants to see me do a sardine challenge, put a comment in caps, all caps, sardine challenge, and I'll accept your challenge, but only if you subscribe. So that's the deal. But yeah, these fish are fatty, but remember, we don't have to fear healthy fats like the fish mentioned above. Full fat yogurt, nothing with added fruit or sugar. That's just going to kind of defeat the purpose. Cottage cheese, pecorino romano cheese, olive oil, butter, eggs. If you can handle nuts, seeds, etc., just be careful with nuts. Those can add up calories very quickly. For your later meals, if you're going to have a dessert, which I do recommend, this would be the time to do it. The reason for this is psychological. You've been doing well all day, measuring your food, staying in your caloric deficit, making the right choices. The last thing you want to do is have an entire cheat meal that will cause you to derail. So I personally intentionally plan for about 300 to 400 calories of fun food every single day. It's like my little reward. Now, I know some people might disagree with rewarding yourself with junk food, or maybe, kind of disagree with that. For some people, it might not be the right idea, but for me personally, I think it helps me. I think a good piece of chocolate is amazing. Lately, I've been having um, these mousses from Wild Fork. They're unbelievable. So I literally wait all day to have my dessert because I don't want to waste my calories on any other junk, just my mousse. So personally, I don't do too well with plant foods, but generally speaking, people that go on a plant-based diet and eliminate all processed foods and refined foods typically tend to improve their diabetes. But again, be mindful of too high of carbohydrate foods. I think the biggest con of plant-based diets is that without supplementation, it's difficult to get all essential amino acids and it's hard to meet your protein goals. So another amazing source of protein is grass-fed and grass-finished ground beef. Ground beef gets a bad rep, but it's one of the most nutrient-dense foods on the planet, along with eggs. I've actually heard of a lot of people drastically improving their weight and diabetes numbers by adhering to a daily consistent diet of like ground beef, butter, bacon, eggs. So this diet can have incredible results for managing diabetes. Of course, be prepared to get some serious pushback if you have a cardiologist because you're most likely going to increase your cholesterol by eating a diet like that. But I'll discuss cholesterol in a different video because this video is now pretty long enough. But remember, I'll be giving out free to my first 1,000 subscribers the first chapter that goes into more details about different diets to help you cut through all the noise. So if you want a free copy of that, please send me an email and I'll email it to you. If you've made it this far, I want to thank you for spending your time with me. I know that time is one of our most precious gifts we can give, and it's finite. So thanks for sharing yours with me today. If you have any questions about this video or any video, feel free to leave me a comment. I read and answer all of them, and I look forward to an engaging community. Again, if you've not subscribed to the channel yet, please consider subscribing and sharing this with the people you love in your life, and I will see you in the next video. God bless you.